Fort Lauderdale, Florida, and the studios of 850 AM WFTL. This is Outlaw, America's alternative voice.
Streaming around the world at outlawshow.com.
This week, we focus on HIV and the law with special guest Steve Fallon of Skills 4 and Pembroke Pines City Commissioner Angelo Castillo. Your host for Outlaw, equal rights activist and former Fort Lauderdale City Commissioner, Dean Trantalis.
Good evening and welcome back. We have here tonight our show with our special guest, Dr. Stephen Fallon, and Commissioner Angelo Castillo, who's President of Broward House here in Broward County, Florida. We've been having a spirited discussion about HIV education and prevention, and a lot of it's been about where we've been in the past, and there's been a touch upon what the government is trying to accomplish with perhaps reformatting its education and outreach programs here in the local area. The statistics that you pointed out earlier tonight, Mr. Castillo, were unfortunate to the extent that they show a marked increase in the incidence of HIV. But tell us a little bit about the demographic that you are finding in terms of who's contracting it more and what communities are experiencing it more.
Well, I had mentioned that Broward is currently the urban county in America with the greatest number of newly diagnosed HIV cases per 100,000 in the United States. Within the county, it's estimated that 1 out of every 109 Broward County residents is living with HIV and AIDS. That's 1 out of every 109. For whites, the rate is 1 in every 127. For Hispanics, the rate is 1 out of 168. But in the black community, the rate is 1 in 43.
And that is new statistics.
That is these are current statistics now. It is an outrageously high number among African American women with HIV. 74% are in the black community, and when we ask them what the most likely way they could have gotten HIV is, the vast majority say that it's coming to them through heterosexual contact. This is an indication that in all communities we have to deal with the phenomenon that has been building up of the down low, and we have to overcome the stigma that we have simply from a public health perspective in reaching out to men and explaining that they have a responsibility, not just to themselves and to their male partners if they're having sex in that way, but if they're also having sex with women, they also have that same responsibility there. It is a major problem, and because of cultural and other forms of stigma, those efforts have not taken place, but they are essential, I believe.
Are you saying that there's resistance within the African American community to broach the subject and to try to bring people to understand the new levels of HIV contraction within their communities?
Look, I think it's fair to say that there's always been and there continues to be a great deal of stigma talking about any issue dealing with sex. It is easier today than it used to be, obviously, but certainly within communities of color, and I'm including, as a Hispanic, I'm including my own community in that. It is very, very difficult to have this conversation about heterosexual or bisexual sex and gay sex in that community. It is a very difficult topic to broach. Yet, from a public health perspective, these statistics are telling us that among particularly low-income people, we have a serious problem in these communities. And in Broward County, among whites, we still have a growing number of HIV cases, and what we're seeing is that they involve young people. And there's a stigma about talking to young people about these issues. So if we don't start overcoming these hang-ups, we're going to end up with a lot of people who are going to get sick.
Before we have Dr. Fallon comment on that, we have a call, Dee from Lake Worth. Dee, can you hear us?
Yeah, I can. I was listening to the recording, then I'm listening to the radio too, so sorry about that.
Okay.
But I support my local community here, and I utilize their services, and I don't know if you're very familiar with an organization called Compass.
Yes, we are.
In Lake Worth.
Yes.
And they also give free testing the first Thursday of every month. But they also test for, I just found out that I had hepatitis B. All right, which is not, I am not HIV positive or anything like that, but I want to make sure that we're still teaching people that those people who have HIV are not like we used to consider people that had, what do I want to say? What's the term where the fingers fell off and everything?
You mean diabetes?
Not diabetes. I'm talking about the ones that were exiled to the
Leprosy.
Leprosy?
Leprosy. Thank you very much. Because I remember when I was living in Brazil and everything, I went to a friend of mine who was working at a leprosy colony, and the people I was living with told me that if I went there, I would not be welcome back because they still thought that leprosy was infectious. Just by looking at the people and talking to the people and this kind of thing. And I want to make sure that we're still educating people to the fact that just by touching somebody with HIV or hugging them or giving them a kiss and everything is not contagious.
Well, early on in this...
And I still think people feel that way.
Well, early on in our history of HIV and AIDS in this community, in this country, certainly the stigma...
I have friends who have died since 1983.
And
in the early stages
as
and
we
everything.
all did.
And I never felt that I had to pull away from them. You understand what I'm saying?
I understand what you're saying. Thank you so much, Dee, and have a good evening. Thank you for your comments.
You know, it is an important comment because you know, there's still this feeling out there that among many that they have this inability to interact with people who are HIV. In fact, interacting with someone with HIV, unless you're exchanging bodily fluids, is you know, blood or semen, is not much different than interacting with anybody else.
Well, you were saying earlier that there's the hang-up about people talking on sexual issues within certain cultures within our community is what is allowing the disease to spread more within those cultures. And
Without
you mentioned
question.
African American, people of color. Yet, it doesn't seem that sexual activity has diminished in those cultures. It's just the talk about it seems to be the problem.
Oh, that's very, very clear. And you know, I want to make it clear to all of our listeners. This isn't me saying this. This is the Centers for Disease Control doing a very scientific study. These are physicians who study this, and they're saying that in populations, Hispanic, black populations, and increasingly in the white community among younger people, we are seeing numbers that make it crystal clear that there is a large amount of bisexual activity going on that is resulting in women getting infected, which is now one of the fastest growing segments of HIV that, that we're seeing.
Have you ever approached an African American pastor and talked to them about the subject?
You know, it is. You know, I have, and I have to tell you, it's very, very difficult for the pastors. It's very, very difficult. They simply feel that it is not a topic that would be welcomed in their churches. But the problem is that we have to find a mechanism through which we can conduct this outreach in a way that is effective. And in the black community, we have the gift of the black churches.
But
because
is that the only
No,
method?
certainly not.
I mean, Dr. Fallon, in the Latino community, I mean, you're not going to Latino churches to spread this message. Tell us a little bit about your approach.
Okay. Well, picking up on what Mr. Castillo said, we do have disproportionate impact in minority communities. Blacks represent about 15% of the population nationwide and over 50% of HIV cases. But when we break down within racial ethnic groups and look at behavioral groups, what we find is that black women and gay men are at the top of the risks in all of those racial and ethnic demographics. Yeah. And the reason for that is because HIV it's a semen receiver disease. So whether you're a heterosexual woman being penetrated by a straight man, or if you're a gay man assuming what they call the bottom roll in anal sex, HIV spreads very easily in those ways. So in
not
Broward
exclusively,
County,
but more easily.
Much more easily, but not exclusively. So in Broward County, for instance, the Latino MSM population experienced...
MSN, men having sex
men
with...
having sex with men. It's a term CDC uses to describe both gay and bisexual, and the ones Mr. Castillo is talking about on the down low who don't identify either way. But when you look at MSM Latinos in Broward, they had the biggest increase of any racial ethnic demographic group, 185% increase in new HIV infections in 6 years in this county. And that's within a county that, as Mr. Castillo said, we're number 2 in the nation for new HIV cases, number 1 in the nation for new AIDS cases out of 3,000 counties nationwide. So we are the lightning zone of HIV here. And one of the things that this leads to is what we call core groups. It means that if I was a heterosexual guy in Lincoln, Nebraska, I could be an unprotected slut. I could sleep with every woman there and I'd probably never get HIV because there's no HIV to get. But if I'm a gay man in Broward County, there's both more HIV in my neighborhood, so whoever I'm sleeping with probably has HIV, more of a chance, and if I assume the bottom roll and I'm receiving semen, then it's much more likely that HIV is going to latch onto me. As Mr. Castillo was saying, it's the same thing in the African-American community for women. Some of this is because of the down low, but some of this is just because there's so much HIV in the African-American community already that a woman sleeping with a man there is rolling dice that are loaded, almost as much as the dice are loaded for the gay community. Although overall, the gay community still has the highest infection rates. The gay community represents 2% of the U.S. population, 61% of the newest infections.
So let me ask you this then. If an African-American woman has contracted HIV, is she a carrier is she a carrier for giving it to other men with whom she would have sex because she is the receiver?
She can give it to other men. It's easier for her to pick it up from a man than to pass it to another. And to make this, since this is a show outlaw, to make it relevant to gay people,
please bring it to our focus.
If you are a top, it certainly doesn't mean you're invulnerable to HIV, but your risk is much lower. But to get over the idea that people are invulnerable, somebody who is a top might start with across the board officially lower risk than somebody who's a bottom. Now here's where we put qualifiers on. If you're uncircumcised, your chances of picking up HIV from the bottom go up 2 to 3 times higher. If you have gonorrhea or they have gonorrhea, your chances of picking up go up 8 times higher again.
Is that because the HIV virus travels with the gonorrhea virus?
Well, because what's happening is wherever you have the gonorrhea, or other STDs to some extent, the body is rushing white blood cells there to try to cure the infection. And then the person who's penetrating is rubbing their urethra right up against cell-rich infected sites that are trying to cure the gonorrhea, but accidentally, remember HIV is in the immune system.
Right.
So those immune cells are trying to cure the gonorrhea, but they're also sending the HIV into the man's urethra, the man's penis.
Well, then let me ask you, how is the federal government, in terms of the approach the CDC is now taking, how do they feel that their new approach is going to be able to have a greater impact on the prevention of the spread of HIV based on the new approach that you spoke about earlier?
Well, they finally heard part of what we've been saying for a decade, but then they did, in my view, possibly the wrong thing with it. Mr. Castillo was talking about Broward House has a program called the M Project. It's based on the empowerment model. Latinos Salud has a similar program. It's based on the same model, but for Latinos only. In fact, if there's any Latino, gay, or bisexual men who want to come to a safe space, they can go to the website latinossalud.org. Salud for Health. And this is a model amongst many others. There's about 28 of them that are proven to change behaviors, but they're very labor intensive. And we have so much HIV in Broward County that we can't curb this epidemic just seating 6 or 12 or 14 guys at a time once a month. There's just too many people who are missing. So we've always been saying to CDC, it's great that you have some of these intensive, scientifically proven methods for reducing HIV, but what about broadcasting some general messages out there to remind everybody who didn't come in for the group that night to wear their condoms? So CDC has come back around now to condom distribution, which they used to say was fairly useless. But a condom handed to you on your way outside the club one night, perhaps you're drunk, you're lonely, you're leaving with somebody, and you meet another gay guy.
Did you see me?
Yes. Another gay guy who smiles at you and gives you a condom and says, hey, you're part of our community. We care about you. Play safe tonight. That's not going to change your life forever. It's not going to teach you anything you didn't know. But you are at an exact moment that you might have otherwise gone home and become involved in unprotected sex.
Well, the policies that you speak about, where you say that the CDC is finally listening to what you've been saying all these years, and in the very use of condoms, would you say that that the government's approach, its policy formations, have been at all influenced by, say, certain religious organizations within our country that were not so willing to say the condom's the answer, but in fact abstinence is the answer?
Wow. I wish that conservatives were true fiscal conservatives, because if they were, there's nothing better you can invest in than HIV prevention. Every time I prevent, or Mr. Castillo's program prevents, an HIV infection from happening, we have just saved society $365,000 worth of lifetime HIV treatment costs. And when you put in the social support programs like AIDS Drug Assistance Program, housing opportunities for people with AIDS, case management, alternative therapies, those figures are 4.5 times higher. So you're saving about $1 million every time you prevent somebody from getting infected. But since the other side of the aisle isn't just looking at fiscal conservatism, but is looking at social conservatism, and you may be familiar with this, there's a law, and I forget the number of it, but they call it the no homo promo law, which says that HIV education can't in any way promote gay lifestyle. So if they can't talk about things like lasting relationships with federal money, because lasting relationships can be a barrier against HIV infection.
But even within the heterosexual community, now that it seems to become the new repository and the new area in which HIV is finding a home, without even referring to the gay community, certainly it would behoove our country to try to spend as much of its resources on trying to educate people and to admit that sex is happening within the teenage age group. Sex is happening with people who are unmarried. I mean, it's happening in all these places, but you're saying social conservatism seems to be interfering with the more fiscal approach or the more realistic approach to how to address this problem. And what I'm finding from what you're saying is that we're being hamstrung with the philosophy of social conservatism, and you're being held back. They're giving you one hand but pulling you back with the other. How do we intend to overcome that? Because certainly the law, as we now see it, is still keeping us back from fully approaching the type of HIV prevention techniques that you've articulated as being the most effective. I mean, and also, Mr. Castillo, you talk about these AIDS prevention programs, but number one, the past hasn't really been working. Is that our fault, or is that the fault of the program?
Well, it has worked, though. Our infection rates were at a high of 160,000 a year, and we dropped them down to 44,000 a year. We were doing great.
Okay.
We want to get them all the way down to nothing.
Right.
But that was a significant improvement. And those efforts were grassroots. When CDC in the initial days was saying, you devise whatever works best in your community, it's when they started to take control. And to go to the political point, in the last cycle, the last time CDC made a change of track, which was an initiative called Advancing HIV Prevention, that actually was somewhat nefarious. Senator Tom Coburn, Republican from Oklahoma, was in a room where only 4 people from CDC were involved in drawing this up, and nobody from CDC saw what the new plan was going to be until it went to print in the Morbidity and Mortality Weekly Report, and then it was fait accompli. Everybody had to do what the new initiative said. Now, I don't think we have too many sneaky things happening in back rooms. It's not politics so much as money. Now it's just a matter of financial desperation. Dr. David Holtgrave's done some amazing studies that says that we can cut this epidemic in half, but we have to raise our spending. And there's no way to raise the spending right now. So they're saying with the limited money we have, let's do what looks, most fantastic, most sexy, and that's the treatment as prevention approach. But the study they're basing this upon was done primarily in other countries, developing nations like Botswana and Thailand and India. 97% of the people in the study were outside the United States. 98% of them were heterosexual. 96% of them were monogamous heterosexuals. So they've taken a model that was proven in other countries and said, this will work here in the United States, where 61% of new infections are gay.
Mr. Castillo, tell us, if it's not social conservatism that has been holding us back, what do you think is holding us back in the African American and Latino cultures, as you've now described it? Is it something? I mean, we're not going to be handing out condoms at the end of church service, but are there other ways to approach the community other than through the message of pastors on Sunday morning? I
think that all of these comments point to a couple of things. The first and foremost is HIV is a communicable disease, and it has to be approached from a public health perspective. And if what we're going to start doing is mixing disciplines like theology and public health and all of these other kinds of things, we're going to get a mixed message. There are ways to deal with an epidemic, which continues. We have been struggling with it way over 30 years. I mean, just this year we marked the 30th World AIDS Day this year. But HIV has been in our life for much longer than that. What we have right now is a bunch of mixed messages, but what we need is a clear public health approach. I don't have a particular problem with meds being used as prophylaxis, but you can't do that to the exclusion of denying medications to the people who are ill. This, to me, makes no sense. So what we haven't had is a fully embraced, bipartisan, in a sense, strategy for how to deal with this. I recall in the early days in New York that there were many physicians, very respected physicians, who were recommending quarantine.
That's what the lady from Lake Worth was talking about.
And I wanted to get back to that comment because it's right on the mark. I can specifically recall that conversation in New York. There are countries in the world that deal with their HIV problem through quarantine. And I just don't think that in an American society it's necessary for us to do that. However, what we have to do is get out of our own way, get over the stigma, get past the denial of characteristics of birth and chance, which are going to continue irrespective of whether you're a Republican or a Democrat or in the new Whig Party. And what we need to do is deal with this from a straightforward public health perspective and deal with it effectively. We have not been able to do that in the United States, and that's why HIV continues to grow.
And how would you approach the African American community, that not so much pastors but other leaders within the community, to suggest how we might best approach the education process and taking it in another direction than it has been taken in the past?
Well, I think it's important, even if it's not part of the service, for pastors to play a role. I do believe, among others, in the community, in spreading the message that you have to be responsible for your own behavior. This is important. How we have sex, the manner in which those transactions occur, the manner in which we approach our own standards for how we conduct ourselves is an important message. We do know what the important things to do are in order to prevent HIV and AIDS, and nailing that down more effectively within the community is a very important message. However, we cannot continue to ignore the many who have HIV in our community, who for lack of testing have not had that HIV detected, who for lack of education are not containing their HIV, who for lack of opportunity are not on medications that they need right now. and who could live better lives if they dealt with them. And for those many in the community, including in the straight community, who believe that this is really something that is just it happens in our lower income areas and among gays, guess what? That's not the case anymore. It is spreading everywhere. HIV is everybody's problem. It is a public health threat to the entire population, and it has to be dealt with in a scientific and appropriate way.
All right. Well, thank you, Commissioner Castillo. Your words are well spoken. And Dr. Fallon, before our hour is up, would you have any final words you'd like to say to our audience?
Sure. For younger gay men, if you have HIV, you can still live long and healthy. That's the good news. For those of you who don't have HIV, it's a lot harder than you think it is. Just because there aren't obituaries, it's still easier to live a life without HIV, so please protect yourself.
All right. Great. Thanks, gentlemen. Thank you so much. It's been an important topic, and your thoughts have really, I think, educated the people who've been listening tonight. Next week, our show is going to feature Congressman Alcee Hastings. It will be the final show of our cycle of 12 shows during this experiment to bring to South Florida, outlaw America's alternative voice, and hopefully with concluding our program with Congressman Hastings, we can talk about many issues that concern not just people in Washington, not just people here in Broward, but people throughout the world, and how these issues are impacting all of us. So thank you again, and I appreciate your being here tonight. Thank you, gentlemen.
Thank you, Dean.